we're quite proud that we're able to get this procedure done in First Cardiology. The thing to understand is it is a fairly new procedure in cardiology, and it has become approved in America and in Europe. It's a lot safer for the patient, minimum discomfort. Patient goes home in 48 hours as opposed to open heart surgery where the patient can be here for a whole week or more. It's done under local anesthesia. So it's a lot easier on the patient. Most patients will prefer it. But the valve is a lot more expensive. Aortic valve stenosis is a fairly common disease amongst the elderly. You can imagine yourself being a patient. You come in, you have this procedure done, you go home in 2 days. No general anesthesia, your chest is not cut open. It's all done through sort of like keyhole surgery of the heart. It's all done percutaneously, and it's a much friendlier procedure for the patient.